The following video has been created to help you have conversations about nutrition in the intensive care unit. Family members may have several questions about nutrition in the ICU, such as, is my family member getting enough nutrition from the feeding tube? How much are they getting? Are there any side effects with tube feeding? Is there anything you can do to reduce side effects? Our nutrition guide also provides more information about nutrition and how it can help recovery. If you have questions, please ask to talk to the dietitian on staff.
Excuse me. Hi. I'm a bit worried about Gina not being able to eat with that tube down her throat. How will she get well if she's not eating or drinking anything?
Gina is being fed through a feeding tube, Mr. Simmons. It means that nutrition is being fed directly into her stomach through a tube. That bag of beige liquid by her bed provides all the nutrition she needs.
Okay, but is that enough? I'm worried she's not getting enough to eat, and so she's going to get weaker.
Actually, the dietitian has calculated exactly how much formula she needs to get the protein and calories to help her recover.
But I've noticed sometimes she's not on the feeding tube because she's away from her room for tests. So what happens then? How can you really be sure she's getting all she needs?
Well, sometimes patients are away from their room for certain medical procedures, but we try and limit those interruptions, and we do track hourly how much patients are being fed while in the ICU.
You said that the dietitian chose the formula so she gets enough. Doesn't that mean that the bag should be finished every day? What if it's only half empty? Does that mean she only got half her meals for the day? I mean, that can't be good for her.
Those are good questions, Mr. Simmons. Studies have shown that getting between 80 and 100% of the formula makes a big difference to recovery. So we try and aim for that amount. Now, if Gina is getting less than the full volume, there are certain things we can do, like limiting the number of interruptions and providing medication that will help her better tolerate the full volume.
That's good to know. Oh, are there any side effects I should know about with tube feeding?
There can be. If a patient's stomach isn't emptying properly, there can be gastric reflux or aspiration. That's when the contents of the stomach flow backwards into the food pipe or into the lungs. That can cause a pneumonia.
Well, is there something that you can do to prevent that?
Yes, raising the head of the bed can help, and that's why we have Gina in a partial sitting position. And of course, the doctor can prescribe medication to prevent that from happening.
Yes, I certainly hope that doesn't happen. Do you think she'll ever eat regularly again?
Well, if Gina comes off the breathing machine, we'll assess her to see if she can start eating and drinking. That can take some time. We'll probably keep that feeding tube in for a while just to make sure she gets enough nutrition. And sometimes patients coming off a breathing machine can have problems swallowing. If that's the case with Gina, we'll bring in a swallowing specialist, a speech-language pathologist, and we'll assess her to make sure she can chew and swallow safely.
Well, I understand. Thank you, really, for taking the time to explain all that. It's just so confusing here. There's so much happening.
I know. But Mr. Simmons, please, don't hesitate to ask questions and let us know if you have any concerns. We're here to help you too.
Thank you.